We have a panel session, and the panel 1 is about policy issues plaguing walkability in MMR. We have the moderator, Zohra Mutabanna. Zohra. She's going to be a moderator for this panel. She's an accomplished architect and urban planner based in Mumbai with over 16 years of experience spanning India, North America, Latin America, and the Middle East. Her expertise lies in sustainable mobility, integrated land use planning, urban designing, and placemaking. I request her to please take her seat, and the rest of the people in the panel 1 are architect Pranav Naik, Dhaval Ashar, Dr. Sanket Khadilkar, Jasmina Khanna.
Thank you so much, Jalpa. So we have, I think, a few slides and presentations that each of the panelists is going to give. So I would request if Access for Hope can first start with the presentation.
Sorry, actually, Jasmina has cerebral palsy, so her head shakes. So usually we ask for a mic on the face. But it was not available. We are Access to Hope. Access to Hope is a non-government organization. We are the founders. She is Jasmina Khanna. She is a software engineer by profession. We had a common mission of working towards accessibility and disabled friendly footpaths, basically.
Just to put it together, everybody here is just talking about walkability, but except for Pankaj sir, who spoke about accessibility, who covered accessibility. Thank you, Pankaj sir. So, uh, so I would like to start off with my presentation. Yeah, go to the next slide. So today I'm going to cover good, bad, ugly part about the whole accessibility scenario. So I think I'm not audible. Yeah. The good part is that there are laws available that have been come into existence, like Disability Rights, Persons with Disability Rights Act of 2016, and there is a public infrastructure accessibility guidelines called the harmonized guidelines by the Urban Ministry of the Indian government. Okay, the bad part is that there is not much awareness about accessibility. There is a lot of lack of awareness about accessibility, and there is a lot of inertia from the government side to implement these guidelines. Uh, so unless awareness is not created, uh, unless there's a will from the government officials to implement the accessibility guidelines, we will not get any results. 100% any results. Pankaj sir, you might be aware of it. So, we have been doing our bit to pressurize the government officials in the last 7 years now. We have been successful to a certain extent, but the ugly part is that there is a lot of corruption at the official level. Sanket, you can.
Continue.
Uh, so, uh, so Truth. Uh, This is the actual reality. How will I go to a railway station? How will I climb up to the footpath unless there is end-to-end connectivity? Oh, here I would like to give an example of a metro. Have you have you ever traveled by metro? If you see a metro, it's end-to-end accessible. Means you can get into the lift to reach the station and get into the train. Look at the apartments are at the level of the platform. So it is easier to get into the train, and their metros are cross visibility access, but not only for wheelchair accessibility. They are cross visibility accessible, making announcements at every station, every whenever a station is coming. That is very important for visually impaired and tactiles are there. And yeah, so as I was talking about uh, uh, mm, uh, implementation, and in the in November 2024, the Supreme Court has given a mandate that every public infrastructure has to be universally accessible in India. So I hope the government implements this order soon. Thank you.
So, just to continue from where, in fact, I wanted only Jasmina to speak, but in the interest of time, we are sharing the presentation between us. So, the Supreme Court actually has a mandate which says that accessibility is a fundamental right. Usually, it is considered that accessibility is a luxury, something luxurious, that you do at the end of that entire project. But actually, it is the start of the project. Accessibility, without accessibility, today Jasmina won't be here talking to you. There is a lift, there is a ramp at the building, the door is wide enough. So that is the reason why Jasmina is able to interact with you. So I would like to touch upon this bell curve, which I found very interesting. So on the x-axis you have physical ability, and on the y-axis you have number of people, right? So the average, it's a bell-shaped curve where the average population comes in the median. So they have a decent amount of physical ability, and there are a lot of people in that group, right? But if you go to the x-axis just in the beginning, there are persons with disabilities, senior citizens, children, mothers carrying children in strollers. So they make up the kind of minority which have limited physical ability. And you have at the higher end of the physical ability, you have athletes, right? So the reason I am putting this graph here is if you tackle the minorities, if you tackle the persons with disabilities, senior citizens, and their mobility, and mothers carrying children in strollers, like Mr. Pankaj Joshi mentioned, or pregnant women, if you tackle their mobility, the average user's mobility gets tackled automatically, not vice versa. If you tackle the average user's mobility, the person with disability might find it difficult. A simple example is this stage, right? Everybody can access this stage, but Jasmina finds it difficult because there is no ramp here. There are steps, right? So what is accessible for able-bodied need not be accessible to all, right? I just want to touch upon this interesting sustainable developmental goal that we just checked of United Nations. So United Nations have these different sustainable developmental goals, SDGs. So we found that there is no sustainable developmental goal for accessibility. And the simple reason which the United Nations gives is accessibility is a horizontal goal across all verticals. So it is not a separate goal. Everything that you do, that has to be accessible. So it need not have its separate place. And what Jasmina was talking about, the harmonized guidelines, they are given by the Urban Ministry. They are very inclusive guidelines, very beautiful on paper, but not implemented on site. So, Mr. Pankaj Joshi, we also have seen it on site. So it's not a banter, or it's not a a complaint, but it is the truth. It is the bitter truth. So, just to give you an idea of what work we do, uh, this was our first initiative in Ville Parle East, where we did footpath accessibility. So you can see that there is a ramp. Of course, we want to be very careful when we say ramps, because ramps are not the only thing that you should have for making structures accessible. But definitely there are ramps which have a proper gradient. You can see that yellow strip. That is actually, it was done in stamp concrete. Later we helped the BMC revise the item list so that the actual tactiles are placed, which you see on railway platforms and metro. And we tried this vinyl proof signage, but that gets washed out, that gets walked upon, it comes off. So we had a different model for the signage. This is like there are trees in between the footpath, so you need to create a exit ramp. That is for wheelchair access. That is for wheelchair accessible buses, buses that are fitted with hydraulic ramps. Those who travel with buses, 180 AC buses are there, 180 number. Not know that there is a ramp in his bus, right? So, and the problem is it stops in the air. That ramp, it stops in the air. So if you can either come midway and then hop down, or you have to climb over. So it's a very dangerous. Anybody wants to, just for the sake of it, try it. We would suggest, we have tried it. So all the people were just stuck in the bus, and we were just busy figuring out the ramp, right? But there are 350 buses. You must have seen it, I can guarantee you. So for those buses, we created this type of ramps, which are and a platform where the ramp will come down, the wheelchair person will come off, and then get off the footpath, or go on to the footpath. On the right is a simple design where you just shift the bus stop towards the compound wall, and we removed the that advertisement banner type thing in front. So we just removed that. So the bus stop stays where it is, and the wheelchair can move freely. I'm talking about wheelchairs more, but we do cross disability accessibility work. This is accessibility, footpath accessibility that we did at Ghatkopar. It was a Godrej residential complex, and we actually used the tactiles, and we worked with CC, cement concrete, which is our favorite mode actually to work with. This is just some technicalities about footpath. So on the left, you see that's a 2-meter wide footpath, right? So the upload on the website. So the footpath, universal footpath policy has been approved. The pedestrian first policy has been converted into a universal footpath policy. The word universal itself states persons with disabilities and senior citizens and pregnant women and average user, right? So there is the 2-meter wide footpath I was talking about. That is the width you require when there is multi-directional travel. This is all mentioned in the universal footpath policy. There's another that is warning tactile. The grooves have to be 5 mm, because another that is warning tactile. The grooves have to be 5 mm, because that the visually impaired have to feel that tactile, right? It's a tactile. On the lower side, you have a gradient. I will not go into detail, but the ramp should not have a very steep slope. Many times you see the ramps which are so steep that you might as well go to the moon, from that ramp. Just launch yourself into the moon. So that gradient has to be gradual, because there are some people who, like today, since the venue wasn't, the stage wasn't accessible, Jasmina used a manual wheelchair. Otherwise, she uses power wheelchair. So I need to hoist. So if the ramp is very steep, it becomes difficult. If in my place there was any senior citizen putting the person on wheelchair over the ramp, it has to be easy, right? Mr. Pankaj Joshi mentioned, if you keep bollards to obstruct two-wheeler entry, then you obstruct the entry of wheelchair users also. Otherwise, if you have spaced bollards, then they have no purpose at all. And then, you know, they fall down, they lean on one side, and it becomes like a kind of a beautification which BMC loves using, you know, beautification word. So we came up with a solution where the two-wheelers get stuck on the bollards, because the wheelchair has a turning radius, right? So Jasmina can literally turn on spot, but with two-wheelers they have a larger turning radius. So they will get stuck, but the wheelchair can move freely. And of course, the pedestrians can use footpath. And mind you, bollards are very unique solution only to India. Elsewhere, people know that footpaths pe bike nahi lana hai, you know. But in India, you need to put bollards to shoo them off, like kind of use your road, don't come on the footpath. And this has been especially when. Uh, Thank you.
Thank you so much, Jasmine and Sanket. So we're going to skip the rest of the presentations in the interest of time. I think we have to speed up what we had planned. So I will request if Dhaval, you can introduce yourself quickly and then give us like a 1 minute quick thought on what you think where we stand on policy issues in walkability, especially responding to also that we're talking of universal accessibility in general, and where WRI has been working in this space.
No, and thank you, Sanket and Jasmina. This was a lovely presentation. Right, so my name is Dhaval Ashar. I work with the World Resources Institute, WRI, India program. I had some of the transport work around the region. So we've been working, I think, in Mumbai since about 12 to 15 years, uh, fairly closely with the BMC all these years. I think, I mean, between Vedant and Pankaj kind of really nicely sort of covered what is possible. Vedant showed what the problems are. I feel like, there's a sort of a new baseline that I think we need to acknowledge right now. I mean, Pankaj, correct me, or I'd love to hear what you think about. I mean, if you're sort of a 16 to 18-year-old, if you know someone who's this age in the city right now, when they become working age, okay, they're going to travel very, very differently compared to what I went through in that phase. Like, I used to live in Borivali, my college in Andheri, then the trains were like so packed, and my early working life was also it's going to be very different. Like, you like the metros, you can, debate its sort of feasibility and things, but it's going to transform in many ways the way we are going to travel in the city in many years. Now, that is also, I feel like we are at a very critical crossroads. Whatever we are building right now, it's with the intention of making it, like, letting it happen for the next 20, 30 years. And I think the chief ministers quoted this also, just wait, like, let's just finish concreting all the roads. So you don't have to worry about potholes. Like the commissioner said, right, concrete is the only material that they are thinking is the pothole solving material. Asphalt can do it, but itna saal se we've not done it, so let's just concrete it. 30 years, right? We'll not have to break it very likely. Um, and metro, I mean, this $6 to $10 billion investment, we are not making it in the next 20, 30 years. In terms of drainage, I mean, we have now upgraded our entire drainage system, gone above and beyond what Brimstow had. I don't know if all of you know, but some of you should go and look up what it was, and done it. I think unless the nature becomes very furious, like it did in July 2005, we may not have that kind of a problem. But we'll have these ankle type of, problems, in which case you may not access the metro. Arey, bahut pani bhara hai, I'll just take my car or something. Your city will move on. I'll come to the point. Few things. As we stand today, I feel like with parking, Vedant kind of gave us an idea of how much space we need for parking that many. Let me tell you one thing. Our parking demand and supply gap is 10 times. Simply means that you are never going to meet demand with supply, right? So the spillover is going to happen. Now, this is a management exercise on the one hand, right? The other is, for those of you who are civil engineers, you will have studied about concrete being a rigid pavement. The rigid pavement for concrete was because it has very low elasticity. It can't do this, whereas asphalt can. But it's rigid in many other ways. If what we are building right now is going to go on for 30 years, but we can't tell, has it been designed carefully? Has it been designed with full accessibility? Have we achieved that we wanted? No, it's fine to say no also, because city is a perennial project. We do something happens, we learn, we get to do something. To do this, when we were in the flexible mode, now it's concrete. Changing from here, our city is quite tired right now with the amount of construction, right? Y'all are all like, let this get over. But then the question after that is what happens after? So I think the change from here on is going to have to be very different. I don't think we are ready to go through an entire series of construction again, just having gone through it. So it is going to have to be with very minimum intervention that can have maximum impact. I don't know what that is. I'm putting all this behind the word innovation. So just wanting to say that, it's kind of, there's a lot of kind of public transport capacity that is going to be added. I hope BST, as promised, also kind of keeps up with that capacity. It is poised to
Frequently like that. We've designed some 15-20 kilometers of footpath, built about 5 maybe in Mumbai. Mostly again around where I live and where I go to work. So the idea of my presentation was just to get more people, to encourage more people to go out and just find out what they can do around their neighborhoods and see what we can do together. Let's build together. That is the idea. The second part is the way the BMC's role has been. So, while the first few projects were sort of incidental with us going out and all of that, we then participated in something called the Mumbai Street Lab, and Dhaval was a part of that. It was a WRI a competition. We started designing it only 4 days before the deadline, and somehow we won the competition, won one of the streets. And once we went to the BMC, the municipal commissioner gave me a piece of paper, certificate and all of that. And we showed them our models, spent lots of money on this. Then they said, we won't give you award money. Then they said, we won't give you fees also. Then we fought with them. We're like, what is this? I want award money at least. So they said, okay, we'll give you 50% of it. And then the rest is GST. So, yeah, fine, okay, then give us that. It'll at least cover our costs. It didn't, but okay, it'll cover our costs. We then got JSW to pay for that footpath and build it at Nepean Road. And after building whatever was outside the Jindal's house, then the footpath stopped. So that is another problem. And we've been growing tired of this, Then the government came up with this idea of tactical urbanism. Now, why is a government doing tactical urbanism? The government is a government, no? Tactical urbanism is what you and I do when the government doesn't listen to us. So why are they saying that we do? Then after that, they said, we will do this new tender and all of you can participate, pay us 15 lakh rupees. So you weren't willing to pay my fee? What is this 15 lakh rupees? I'm not going to pay you 15 lakh. So they said, okay, we'll reduce it to 2 lakh. No, sorry, can't pay 2 lakh also, can't afford it. So that's how it's been going. So I don't know what the BMC is saying that they are listening to us. I don't know what that is. I don't think they're listening to us because our calculation
10, 12 years ago when we built that first footpath was that Mumbai needs about 6,000 crore to do all of their footpaths. Now that is only 0.8. Like if I was to divide it by their whole budget, it's only now 0.8% of their budget. So we can't even spare 1% of the budget. So now they're saying that we're going to spend 100 crore, which won't even cover fees to design all these footpaths that are 4,000 crore, 4,000 kilometer of footpaths to be done in Bombay. So we have a big problem. We have 20,000 crore being spent on the coastal road, which actually, if you divide that, you will get to 232 million US dollar per kilometer. If you just compare that to Austria, which has the best roads in the world, Austria spends $13 million per kilometer, and Bombay has spent 232. So we have spent $220 million per kilometer more than Austria. So we could have gotten Austrian engineers to come here, put them up in the Taj and Four Seasons and all of that, and yet got better footpath, better, road. That coastal road would have been better. And we would have spared money to, like, I don't know, build jacuzzis for ourselves. Like, I don't know what we would have done. So this, I think, the numbers is something that they never talk about, and it would have been great to have them here so that we can debate them on this number. Because if the number was $1 million per kilometer, okay, fine, we agree. But 220 is way too much. So where do we go next?
Ms. Pranav. Thank you. Great thoughts. Okay, I want to take you to one more. Maybe that can be our last question, and all of you all can address it as you see fit. We heard a lot about, the effort in making our footpaths better, and hawkers being a big problem, and also parking is a problem, and a lot of things are a problem. But are we missing the real problem? Are all of these just symptoms of the issue? Maybe we have to go a little far back and think about how did we land here? And my theory is that possibly there are two policy thoughts or policy directions that we took maybe much earlier that have led us in this situation. One is a prioritization of cars, because of course we're a upwardly mobile, aspirational middle class, and Mumbaikars are being richer and they want to drive cars apparently. Whereas we saw that half of our population still walks, and a quarter goes by train. So there's a very small percentage who really drives. And yet we thought that we needed to widen roads for cars, and so let's take away some space from these the footpaths that we have. And the second thing has been that we have priced out the poor. We have priced out their ability to live, their ability to shop, their ability to even fund basic things to live. So all their functions are out on the street. The poorest poor live on the street, but the not so poor eat on the street, they shop on the street. They cannot afford to go in a shop. If you go near a station, anywhere near a station, the shops that are there near a station are not affordable by half of our population. It is the hawkers who are on the road that are really affordable. So we keep thinking of them as a problem, and who are we telling that you should not buy from them? Half of your population is poor. They are not attending such conclaves. They don't know that they are supposed to avoid buying here. So all of these issues together now, bringing back to the question, that we have prioritized cars over people, even though our national urban transport policy says that we should do the reverse. We have priced out the poor, and now their functions are happening on the street. We want our streets back. And obviously the footpaths are the pedestrians are the one who are squeezed in the middle, and they have no space now. How do we even address, this is not an engineering problem, but we're trying to address it through design and engineering. How do we go back? How do we address this as a policy issue? What are your thoughts on this, and who are all the stakeholders who need to be a part of this conversation to even start making it happen?
No, thanks, Zohra. That was in my monologue in the first one. I missed this part, but I want to throw in two words here. One is induced demand, and the other is latent demand. And simply sort of tell you quickly what it is. So induced is if there is an empty road, okay, and you know about it, you're like, okay, let me just drive today. It's empty. In city of 2 crore people, there's going to be a lot of people like you. So that road sort of has induced demand. What we've seen in Mumbai, there was a graph actually in my that was the only slide I had. Was as we've built these projects over 20 years, we've constantly seen our sort of vehicle ownership go. The other is latent. You know, all those that have cars are also not driving, right? That doesn't mean they won't or they can't. And like Zohra said, the aspirational sort of urban Mumbaiker could still end up buying a lot more cars. So latent, we are operating at very high latent demand. Now to answer directly Zohra's question, what I think, I feel like this careful design, so something that Pankaj showed us, and a lot of other, a lot of us are involved. I feel that is going to be the key. Like I just to quote, I think I was reading from who's the urban designer from New York, the famous Jane Jacobs, right? Sorry, how can I even forget the name? But is that those very little projects may seem trivial, but the sum of it is not trivial at all. And I mean, to me, it seems very clearly our best bet out of this right now. So yeah, I think just going to go with
I think for the like to think about hawkers and congested areas outside stations, there's there's a very clear way that you can do it is to sort of clean it up, acknowledge that the hawkers exist, that there is a need for this marketplace, because there's also the affordability of being able to. So if I go to a shop, I may buy supplies for a week, but there are so many people who buy only for the day because that's their affordability. They're buying it day every day. And so that's the problem, is the size of the fridge and all of those things that combinedly get you to that problem. So now when you have that kind of situation, we need to acknowledge that this needs to be catered for and not pushed under a rug, which is what is happening. And in the policy, it's like, not in the policy, I think it's more like what is being done on ground is a marketplace far away. Like at the other station, there's something that's far away and doesn't work in a commuter's way of passage, and then there's a problem. So those are the kind of solutions that we should look at.
Great. Yeah, thanks. Yes, Sanket.
So actually, Zohra ma'am got out a very complex, it's like a complex psychosocial issue. And as she rightly said, the pedestrians and the beneficiaries, we can call them, the end users, are getting sandwiched. It's a very complex question. I don't have an answer. But I just wanted to mention that there is Article 19 in the Constitution, which has two sub-clauses. One of them is right to livelihood, which hawkers actually earn quite a lot. They earn quite a lot on the footpath, and they don't have to pay any rent. Quite a lot on the footpath, and they don't have to pay any rent. So can't they shift to like a a rented place in that same vicinity? We also heard from the BMC, in collaboration with BMC we work. So we heard that BMC creates these hawking zones, and they have these infrastructure built where the hawkers can shift. But it's a tricky process because the hawkers don't want to leave their location because it's a prime location. And then the BMC says we have already built, but they have refused to come into that infrastructure. So it's a really complex issue.
Okay, thank you very much for the panel discussion. Wait. We have to felicitate all of you all. Just give me a minute, please. Okay, all right.